Hi, I'm Dr. Wallace with Catawba Heights Animal Hospital, here with some questions and answers today for cats with urinary problems. I've got some questions here I'm going to read out and go over with you. So, what are the most common urinary problems in cats? Urinary problems in cats is something we see quite frequently. Um, it's very rare to see a urinary tract infection caused by bacteria in younger cats. We can see those in older cats over the age of, say, around 10, but anything young, 3, 4, 5, very rarely do we see bacteria. Typically, we see feline lower urinary tract issues simply due to inflammation, feline cystitis, which is inflammation of the bladder without a active infection going on. We also see crystals in the urine, and sometimes we can see bladder stones. And those come from the pH of the urine being too high and allowing ammonia to form, and it saturates out of the urine to form these crystals, which eventually form stones. What causes urinary problems in cats? A lot of times we don't know. Stress can be one. Cats are very easily stressed, but they don't show outward signs. And one of the things that can be a sequela of stress is frequent urinary issues. So they might have blood in their urine without an infection, which is cystitis, or they might have FLUD, feline lower urinary tract disease, which is inflammation of the bladder, crystals, stones, mucus that's produced by the bladder, a lot of times for reasons we don't know, but stress can play a role. Are certain breeds or ages more prone to urinary issues? I would say no. I see it across all breeds of cats, all ages of cats. Um, we can see more issues in males than females simply because male cats have a very small, shorter, or very small urethra compared to female cats, which are a little bit wider. If a cat is going to block to where they can't urinate, it's going to be a boy cat over a girl cat 90% of the time. Boy cats will block when they get mucus, if they have a stone, if they have a plug of crystals, and they're a tiny little urethra. It doesn't take much at all. That's why it's very important to monitor your pet's urination habits and make sure they're going to the bathroom regularly, and not going overly frequently and nothing's coming out. So, what are some signs of urination problems in pets? Cats straining to urinate, where they go to the litter box and they're posturing and pushing and nothing is coming out, or there might be little drips but not a full stream. It's important that they have a full stream when they pee. They can go to the litter box many times, and these mechanical like litter boxes, like the litter robot, are very popular, and they have sensors and motions in them to where it can detect when your pet goes in. It'll also has a scale in it, so it can kind of detect which pet is in there. If they're relatively close to the same weight, like one's 2.3 pounds and one's 2.4, it may not detect it. But if you have a 10-pound cat and a 15-pound cat, it can detect that. So you can monitor on your phone who's going in and out of the litter box more. You might see blood in the urine. You might see them avoiding the litter box and peeing elsewhere in the house. And you might even see them over excessive grooming or licking in the genital area. How can I tell if my cat's urinary problem is an emergency? If they have not peed in 24 hours, they need to see a veterinarian. Period. End of sentence. Seek care right away. How does a veterinarian diagnose urinary problems in cats? On physical exam, we can determine how full the bladder is. If the bladder is very full, very hard, very painful, we know we have an emergency with a blockage on our hand. We will collect a urine sample and we will try and decompress the bladder, pull some urine out for their comfort, but also to help their bladder. Um, we will also run blood work to see how their electrolytes and kidneys are handling it, because it can throw their electrolytes off, a blockage, and also it can cause acute kidney failure if they can't pee. And then we also look at the urine under the microscope to see if we have bacteria, red cells, white cells, and to see if we see any crystals. How are urinary blockages treated in cats? Typically in cats, once their blood work is done and it's safe to anesthetize them, we will sedate them and we will pass a catheter back up the urethra and push whatever the blockage is back into the urethra. And it's a case by case situation. Sometimes they stay in the hospital for a couple of days if their kidneys are abnormal, they're dehydrated, don't feel well. Sometimes it's 12 to 24 hours if they're doing well and it was a simple blockage. If your cat's potassium is elevated, we will not do surgery right away. We will not decompress. We will not catheterize the bladder right away. If your pet's potassium is elevated, we have to get the potassium down before we sedate your pet, or it will cause an arrhythmia in the heart, which could be fatal. So in some cases, your pet may need to be transferred to another location, or passing a catheter will be delayed until we can stabilize your pet. Can stress impact my pet's urinary health? Absolutely, stress can. Cats are very sensitive creatures. A lot of times we will see a lot of urinary issues after the holidays because people have had people come over, friends come over, they've gone to boarding, people are bringing pets over to the house. If you get a new pet, another cat, another dog, whatever, it can be stressful to your cat. Cats are very sensitive. You just have to watch them and make sure they're doing well. If we have pets that are recurrently blocking due to stressful situations, those are pets that we might recommend an anti-anxiety medicine for, like Prozac. It's important to maintain hydration for your cat for their urinary health. Most cats do not like stagnant water. Most cats prefer flowing fresh water. That's why cats like to go to the toilet, or they like to go to the sink or the bathtub to drink the water. So a cat fountain is an excellent source of water for your cat. It keeps it going, it keeps it fresh, it encourages them to drink. Can urinary problems become chronic in cats? Yes, they can. And that's where prescription urinary food, it's kind of like medicine in a bag. It can help treat your pet if they stay specifically on that diet and don't eat anything else. It can help with those chronic urinary problems and prevent them from having to come see me more frequently. With diets, there are over-the-counter versions and there are prescription versions. The over-the-counter versions rarely are enough to control chronic cystitis or cystitis in cats. Typically, you have to go to the prescription variety. It's Urinary SO by Royal Canin, CD Multi by Hill Science Diet, or UR by Purina. They come in dry and they come in canned, and cats can be picky. So with canned, they come in the pate variety, or they can come with chunks and sauce, different flavors. There are many out there for your pets to try, and those three companies will have a guarantee with their food. So if your pet won't eat it, we have to change it for some reason, you can bring it back to us if you purchased it from us. If you purchased it elsewhere, you'd have to contact them about their policy. What are the best ways to monitor your cat's urinary health over time? The best way is to get one of the litter boxes that monitors when pets go in and out. Some can be quite expensive, but there's inexpensive options on Amazon, but also cleaning your litter box daily. Are there specific litter types that help identify urinary issues early? There are some litters out there that I think can turn colors. I'm not very familiar with them. I think if you just pay attention to your pet's activity in the home and cleaning the litter box daily to every other day is just as good as using these fancy litters that might turn a different color. Can a urinary infection resolve on its own, or does it always need treatment? If it's a true infection with bacteria, no, it needs antibiotics. It will not go away. If it's inflammatory, possibly it could go away if we get whatever is causing the inflammation down or the stress down. But a lot of times those pets will need anti-inflammatory medication like Onsior to help with that. If my cat has recurring urinary problems, talk to your veterinarian. If it's a boy cat that's constantly blocking despite trying dietary issues, there's a surgery that can help reduce the chances of blockage. If it's recurrent, talk to your veterinarian about diets, talk to them about anxiety medicines like Prozac. There are many, many options out there. Male cats are more likely to experience a blockage because they have a very tiny, short urethra that it doesn't take much to block at all. Tiny sand particles easily block their urethra. Feline idiopathic cystitis, or FIC, is a inflammation of the bladder without an infection present. I've already kind of talked about this, and it's managed a lot of times through dietary with the prescription urinary diets, or sometimes it can even be managed with anti-anxiety medications. When should I take my cat to the vet for urinary problems? If you see them going more frequently in and out of the litter box for more than 24 hours, if you see blood in the urine, or if they have not urinated at all in 24 hours, please give us a call. If you have any questions regarding your pet's urinary problems, give us a call at 704-827